Hi everyone, and welcome to The Final Kick, a webinar hosted by Southern Cross University for the Gold Coast Marathon. Southern Cross University is the official education partner for the Gold Coast Marathon, so we've designed this webinar to help you prepare. Whether you're entered into the Southern Cross University 10K, the half marathon or the full marathon, hopefully you can get some tips from today to help with your training and to help give you the best performance on race day and to help you enjoy the event as well. I'm your host for today. My name is Dr. Chris Stevens, and I'm the lead for the Human Sciences and Rehabilitation suite of courses at Southern Cross University. And I'm also an accredited sports scientist and a researcher in endurance sports performance as well. We have a panel of speakers with us today, including Courtney Atkinson, who is a two-time Olympian, three-time Noosa triathlon champion, and long-time Red Bull athlete with a career built around endurance performance, and he's best known for his Olympic triathlon career. Courtney has always had a strong running background, from track and cross country as a junior, through to world-class triathlon racing, and now into road running, marathon training, and trail running. Through his work with Red Bull, endurance events, and In the Beginning podcast, Courtney brings a practical athlete's view on performance, how to train smarter, manage load, build consistency, stay healthy, and keep the competitive fire without letting ego take over. He's currently applying many of those lessons in his own running, from marathon preparation through to longer trail challenges, making his perspective especially useful for runners trying to improve while balancing real life, injury risk, and race day ambition. Welcome, Courtney. Thank you for joining us.
It's great to be here, Chris, and I think the beauty is I've got that background, but these days I get to talk to all the best runners as well. So I'm bringing all of that information and hopefully I can share some of that today.
Yep, absolutely. Looking forward to hearing from all of your experience. Our next panel member is Bimbi Gray, who is a registered osteopath, teaching scholar and course coordinator for Osteopathy at Southern Cross University. She's also an early career researcher, currently completing her PhD with a focus on evidence-based practice and translating research into clinical care. Alongside her academic work, Bimbi is an experienced trail and endurance runner, having completed multiple ultramarathons in Australia and internationally, and brings a practical perspective on training, injury management, and performance. Welcome, Bimbi.
Great to be here, thanks.
And our next panel member is Chrissy, who is a clinical trial research fellow at Southern Cross University's Faculty of Health, a registered nutritionist and health author with over 20 years experience in the nutrition and health industry, and her work focuses on muscle health and how diet and exercise support body composition and long-term health. She's passionate about practical strategies for healthy aging and is a former keen marathon runner as well. Welcome, Chrissy.
Thanks, Chris. Lovely to be here.
Firstly, Courtney, can I say I'm a big triathlon fan from way back. I remember watching you in the Accenture triathlon series on telly.
Yep.
And you were absolutely dominating the sport of triathlon at that time. And that really inspired me to jump in the neighbour's pool, swim some laps, go out and ride my bike and run around the neighbourhood in the official triathlon format, and eventually take up the sport of triathlon myself. So it's surreal to be sitting with you here today talking about triathlon and all things performance. You've had a great career. You've had 2 Olympics, but this is your first time, the Gold Coast Marathon, the first time racing the marathon.
Yeah, wow.
So tell us, how's it feel and how's the training going?
Well, thank you for the kind words. That took me back a long time. I mean, I was just a kid, just like you were watching me. I was watching, we're trying to emulate Brad Bevan and Greg Welsh and the people who pioneered triathlon, but to come full circle, I mean, my roots are in running. So when I was at school here on the Gold Coast, it was the early days of, I suppose I was just a kid out running cross country. I mean, the first time I realised I could actually run, I was in a pair of army boots out the back here on the Gold Coast at a cadet camp of all things. And they said, just run around the loop, and first place got a army boot on a piece of wood. That was my first day of realising I could run, and then fast forward, I got to the Olympics. But as a junior, I suppose I was, very involved around track running at a national level and cross country. So when I went off to race Olympics for triathlon, the guys I was racing as kids, Marty Dent went to race the Olympic marathon. So we ended up at the same Olympic Games, but in two different sports. So for me, this whole marathon and Gold Coast Marathon especially, which we talk about so much, it's me coming back to my roots. And I mean, I've run trail races that are longer than a marathon. I've attempted a few Ironmans. I won't say I was the greatest Ironman. I did halves very well, but Ironmans. So I've run that marathon distance, but this year will be the first time I've actually got out and run it. And the great thing at the moment is, obviously I'm talking about it, I've got a background in running, but each week we talk to Benita Willis, who's Australia's greatest female runner over the marathon distance. Last week I was talking to Andy Buchanan, who's the current Australian record holder, and I'm just taking all of this information as well and putting that on top of mine. And you know what? Sometimes my head explodes because it's like, you ask 10 different people, you're going to get 10 different answers. But I'll do my best today to try and wrap that up and give the best information I can. Yeah.
So even though you've got so much experience in the sport yourself, you still find having that guidance from a coach to be useful?
100%. There's a lot of ways you can go about running and training nowadays with AI out there. There's, there's all different systems. You can just jump on, on the web these days and it'll pump out a structured program for you, which is really good and can help you along the way. There's a lot of apps that will take you from 5K to marathon, and whichever way you choose is up to you. However, nothing replaces having someone there making you accountable for what you do, even up to the Olympic level. That's imperative, because the main thing is you'll always, especially if you're a motivated runner, you'll always make decisions on wanting to do more, because believing more will get me better. And having a coach there, and the right coach, and them understanding what you're doing running, they're always going to make the decisions on what's best for you. And often that's actually doing less or recovering more.
Yep. And from everything you've learnt, from the people you're getting to speak to and your career and trial and error, what have you found to be some of the main principles that have helped you get the most out of your training?
Yeah, well, we debate, see, there's a thing in running, more is more. So this is the hardest thing when it comes to distance running, is that no one debates that if you can do more work, generally, in a general sense, you will run better. However, the nuance is, what goes into that more is more. And the thing for me is there's no getting away. If I had to put one constructive structure into place, it's the more you can be consistent for longer without getting injured. I'm sure we can talk about this a bit later. The longer you can do that and be consistent at doing that, the better the outcome down the road. Because the one thing with endurance training is there's no limit. It's like compounding interest with finance. The more you can do it year to year and layer upon layer that endurance base, and I'd love to have for you to talk about your understanding, Chris, around this too. But that more compound year to year in endurance, you can keep improving right through to like quite an old age.
Yep. And you've from listening to you in your podcast in the beginning, it sounds like you've been taking quite a conservative approach this time around. And you say that a motivated running yourself, you want to do more, but also you're starting to listen more to the signals that you're getting of if you're waking up sore, you're actually changing what training you're doing despite what's on your plan.
100%. I mean, if you ask me what's an ideal preparation for, this is me personally, what do I need to run in kilometres per week to get my optimal marathon? I'll be like, I want to run 130 to 160K a week. The reality is, every time I've tried to do that over the past years, the body's just broken down. So what we've done is we've gone, okay, I've worked with strength and conditioning coaches. We'll talk about the teams around you when you go running, when you're training for running as well. But we've worked out, okay, let's go conservative into this first one that we're going to try. And I've only been running every second day. So I'm still not, it's not like I'm not training. I'm on the bike every second day, but it's just taking a little bit of that compounding load off the body. And so far, touch wood.
Yep.
What are we now? 4 weeks out? Yep. Things are moving along. Like, I'm feeling a lot better than I have. But the reality there that I've got to face is that, in my world, or the pace that I would ideally like to run, that's probably not ideal. but that's where you've got to find that healthy balance. And I think for the everyday runner out there, you can, it's very easy to jump online, research, listen to podcasts, and you often hear what the elites are doing. I think it's just so important to understand that the elites are that's their full-time job. Yeah. Just like you'll have your job that you go out to do. If you're listening to elites and what they're trying to do, they're recovering full-time. They've got all the time in the world. They've probably got dietitians, nutritionists behind them, strength and conditioning. They've got the whole team behind them to make them to be able to do that. And you've just got to go out there and find the balance of within your lifestyle, how you can optimize what you want to do running, but also realize, hey, I'm not a full-time runner either.
Yep, absolutely. And they might even have an osteopath working in their team as well. So we've got our resident.
Meet yourself where you're at, I think, that's what I'm hearing. People need to meet themselves where they're at with their training and with their particular load and everything else that's going on in their life as well.
Yeah. I'm sure you're seeing plenty of runners at the moment.
We are.
It's peak time, right?
Fitting with what's realistic with your lifestyle, right? Like it's got to be achievable.
And speaking of the support that athletes have around them, we've got our resident osteopath here with us. So Bimbi, can you tell us a little bit about what role osteopathy plays in performance and recovery for a runner?
Oh. Well, osteopaths look at the whole body structure and how it functions. So we don't just look at the one area that somebody might be having a niggle or having some issues with. So looking at the biology and the physiology of a person, but also the psychology and the social and environmental factors as well. So that's all really important. And then when it comes to particular injuries or musculoskeletal concerns that a person might have, looking at the biomechanics and the whole body's structure and the interrelatedness of those different structures. So, for example, somebody might have some tightness or restriction in the upper thorax, in the upper body, and that might change the way somebody swings their arms, which then in turn changes the pelvic rotation, which then in turn changes the distribution of the weight through the lower limb, and then they might develop a knee niggle or something like that. So we would work with the person on an individual level and, a bit like what you're saying, meet that person where they're at, in a holistic way.
Yep. And what are some of the most common injuries that you would see as an osteopath?
Most common, I don't know if it's necessarily an injury, but we'll be looking at the balance or the imbalance between load and tissue capacity in most runners, particularly looking at, a month out to the marathon. So we're thinking things like the ITB type pains or syndromes, patellofemoral pain, Achilles tendinopathy, tendinitis, those types of things. But other things, I guess, we would look out for more persistent types of pain as well. And we use a clinical framework to sort of understand, what's going on with that person, and also looking at their what their load and their capacity is like in that sense.
And for our runners out there preparing for the events with getting up to some of their highest loads, probably this week, and some very long runs, I guess, happening this weekend. What are some things to look out for? Some early warning signs, perhaps, for some of these injuries that people should be aware of.
Yeah, I think one of the common things with soft tissue and connective tissue issues or strains is that you'll be looking at the warm-up phenomenon. So it takes a little while for the tissues or the area to warm up, then the pain sort of recedes or passes when you're in the run, and then it might come back afterwards. And that's really consistent with, say, connective tissue or tendinopathy type pictures. And a lot of that is okay to run through, but I think it might be important to think about how you could change things up in terms of load or cross-training, strength training, I think is really important. So getting some advice from your health professional, be it an osteopath, a physiotherapist, an exercise physiologist, or even just some advice around how to change your load and training from your coach, I think is really important. But the other things I think we would really look out for is persistent pain, or pain that's really sharp or localised and tender that doesn't go away during the run, or persists for 24 hours or 48 hours after the run. And I think that's when it's really time to have things checked and consider the load and the capacity and change things up a little bit and get some advice.
Yep. And Chrissy, you're an expert on muscle and bone health. So what would you say about running? It's obviously great for muscle and bone health, but
yeah, so obviously running is really beneficial for health, cardiovascular health. But as we start to age, we do start to see changes in our body composition. So predominantly muscle, also our bone density. So we start to experience a progressive loss of muscle, particularly from our 40s onwards. It's about 0.5% to 1% per year on average. This becomes higher after our 50s. And in our bone density, we reach our peak bone density in our mid-20s, and then we start to experience decreases from our 30s onwards. For women, this becomes particularly relevant after 50 or post-menopause, because estrogen plays a really protective role for bone regulation. So we know that running for bone density, that impact exercise is really important, and running is a great impact exercise, and it's weight bearing. So that's great, particularly for our bones in our legs, particularly. And for muscle, we're building muscles in your quadriceps, in your hamstrings, in your glutes. However, for your upper body, running isn't particularly working on your upper body. So as you're aging, you're really wanting to incorporate that cross training, where you're also including some strength training for your muscle health, for your overall muscle health. It also can help with that load, as you were talking about, Bimbi, so taking off that load of pounding the pavement every day. And that's going to help with your long-term muscle health and bone density. It also reduces injury risk as well.
Do you have any, so just recently, like I've run my whole life and I had my first femoral stress fracture only last year.
Yeah, okay.
So it probably fits in with the age thing to a degree, but do you have any strategies around that bone stress that you could be doing from a dietary point of view that could help you with the lead up to that?
So that's a really important thing too. So whilst we know that weight bearing and impact exercise is so important for bone, but so is our nutrition. And so what can happen with runners, if they're not getting that adequate nutrition to support their bone as well, so calcium, vitamin D, etc., and then they've got that high load that can place them at risk of fractures.
Is there anything specific around what, because I know last year when I had that, some of the people I worked with, I believe it was, got to think of what they were giving me now, not a calcium mix, it's just left my brain what they were doing. But is there any supplementation?
So with bone, calcium supplementation is an interesting one. It's not necessarily beneficial. So it's that overall dietary intake from calcium that is more important than taking a calcium supplement.
Okay. I know what it was, bone broth.
Oh, okay. Well, bone broth is naturally high in minerals, so that makes sense.
Okay. Cool.
And
the good thing about healing a bone stress fracture is that there's a lot of circulation. For runners, it's great to consider other aerobic exercises to help improve circulation and blood flow to the area, which isn't necessarily high impact or high load in that area. So I think that's one of the beneficial, physiological and exercise approaches that we would take.
Being able to deload.
Yeah, being a deload, but still keep up some aerobic activity. And that way you're still preserving that really hard-earned cardiorespiratory energy that you've been working really hard to develop as a runner. Yeah.
I'm wondering over your career how much more emphasis you're having to put on the recovery and thinking about nutritional strategies. I don't know if that was a big focus of you when you were a kid, competing at a high level, but now as you're still competitive and still trying to keep competing at a high level, but also trying to stay healthy and get to the start line.
Yeah, I think it's changed because in Australia, when you're in an Olympic level, I suppose you've got such good teams around you, like the Australian Institute of Sport have such a multidisciplinary team that I never really thought about it. We'd go to just as an example for it, if we went to race in Singapore, our dietitian would take a slushy machine with us. So we were thinking about how do you cool down after the race to recover for the next weekend's racing, because we'd be racing every second weekend over 2-hour events, could be in cold conditions, hot conditions. So I never really thought about it. But then since you're kind of out fending for yourself a little bit more. You've got to go and, search out for those people you trust. And I think, when it comes to osteo, over my career, I have used an osteopath definitely into one of my Olympic builds. Andy Gordon is an osteo here on the Gold Coast that I used. And what was interesting with, I suppose, the team that we'd put around us is one of the core things that was always key for me is that the relationship you had with that provider, whether it was an osteopath, whether it was a physio, whether it was a sports scientist, it was the relationship that I could work with them in that was really the key, and it was the trust you had with them that was always, most beneficial to me. And then the second part of that with who you chose as your team around you was a lot of the time, like for instance, Andy as an osteo, when it was more, there was an injury or something going on, I'm sure it was treated with that pretense of coming from that expertise. However, week to week, I was still able to manage to get my soft tissue work done at the same place. So I'd always go personally looking for someone who has like quite a wide view and a holistic view of being able to help you, and then off them, they would then be able to recommend, okay, well, maybe going, oh, this is someone I trust, and go off and work them. So trust is a big thing when it comes to expertise in helping you across the space. And the coach you work with on running specific, I think that's always another good one, is that there's one person doesn't know everything. That's the key thing. Later in my career, I've learned you need to have the right expertise around you at the right time and be able to trust in a whole team. And when you're like an individual runner, you'll think, well, hey, I'm just out there running for myself. But it's no different to your GP. If you went to your GP and there's something specifically that's wrong, the GP is not going to be able to look after all yourself. He'll send you to a thing. So that's my
team
biggest
care and support.
that's my biggest advice around having a team. It's you don't have to have them all the time, but knowing when to go and get that expertise.
And what about from the osteopath's perspective in terms of building trust with your clients? And say, for example, someone comes to you with a niggle, how do you assess whether that is something, they need to make a change to their training prescription or and I guess, how do you build that trust with your clients?
And developing trust and rapport and a relationship, professional relationship with our patients and clients is, at the heart of what we do. And, a bit like what you were saying before, it's meeting people where they're at. I've never had a good experience telling a runner, and as a runner myself, saying, you're not to run anymore. So I think understanding who you're working with and what rest or what sort of adaptations are realistic for that person is really super important. But, I agree with you. We need to work in a multidisciplinary setting, I have a scope of practice as an osteopath, and I would work with coaches, physiotherapists, exercise physiologists, nutrition, dietetics as well. So amongst many others, and GPs where it's indicated. So I think having that trust and with your patient, but also within the wider healthcare network that you're practicing is really important.
And where's that line between someone that's got a niggle that can continue to train as normal, or actually, no, hang on, we've got an injury here.
Yeah.
We need to do something.
I think that's the billion-dollar question leading into race day. And I think it's a cause of a lot of anxiety, especially when people are coming into their peak load of training cycles for an event. Firstly, I think we need to differentiate between hurt and harm. So with running a marathon, it's going to be expected, and even with some training sessions, there's going to be a bit of hurt in that. It's not going to be, there's going to be some discomfort, and pain is a really subjective experience. So understanding the difference between hurt and harm within yourself, I think, is really important. And there's lots of resources, and perhaps meeting with a health professional so that they can talk you through the differences if you're unsure is a really good place to start. But generally, pain within a tolerable adaptative load of around 2 to 3 out of a 10 pain scale is probably okay, particularly if it dissipates. Although if it persists and becomes more chronic, then I think it's time to get some get some things checked. Yeah.
Yep. I'm getting the sense this is really crucial for a lot of our listeners thinking about, coming into the race with maybe a few niggles. So I guess wanted to dive a little bit more into the injury side of things, and I wondered if you could talk to us a little bit about some simple osteopathy informed strategies that runners can use for recovery.
Yeah. Well, I think putting time into the warm-up and the cool-down of your training sessions is really important, particularly if you are managing an injury or coming out of an injury, or you have a little bit of a niggle. But even then, I think ideally you would do some functional warm-up and cool-down. But I guess in terms of recovery and managing injuries, I think it's really important to think about just after a long run, active recovery and mobilisation. So the temptation after a long run or after a race is to sort of lie around on the couch all day. But I would encourage you to think about getting up and having an easy walk, or, if you're in that elite area, perhaps even a gentle, easy run. But yeah, just keep moving and mobilise. And then I guess the other thing is sort of deloading tissues. So some people might find some easy foam rolling, some gentle foam rolling might help, or some light self-massage or seeking out some manual therapy might help. But yeah, just generalising that kind of tissue recovery and repair. But I also wouldn't underestimate the physiological pillars of recovery, so hydration, adequate nutrition and sleep as well. So, it takes a lot of energy and demand to recover and repair tissues. So I'm sure you can talk more about that, Chrissy. But yeah, I'd just say prioritise those three things, nutrition, hydration and sleep.
What's been your experience, Courtney? What have you found has worked for you over the years with your recovery?
Sleep's a big one, right? If you go through if you're jet lagged, I think that's the best example. If you've ever been jet lagged, you know exactly how tired you're going to get. Just on the weekend, we were out doing an event which went for 24 hours. So we, literally didn't sleep for 38 hours. And then when I went to run after that, as an example, notice suddenly your heart rate's spiking, even tissue everything. The body just doesn't work the same when it's not getting that adequate rest. And I say there's, I think we were talking before we jumped on here, and it's there's so many, let's say 1%ers now that you can do from nutrition and before you run, from just strategies before you run. But if you try and do 100 1%ers, it actually takes more time up than what you can do to go and get the 95% of actually just doing the training. So I often say my favourite way to rest is when I get home from a run is to put on Netflix and lay on the couch and just chill out. It's just to allow the body, and look, there's other ways. You could, of course, foam roll, have a light stretch. These days with technology and Normatec boots, and it's up to you how far you want to go with it, but nothing beats just physically letting the body, both body and mind, just chill down and rest, and then sleep on top of that. That's the best strategy.
Yep. There's quite a few studies about the 1%ers and combining a lot of them together. And when you combine a lot of 1%ers together, the performance benefit you get, I don't know if you can guess, still 1%.
Still 1%.
So yeah, it goes to show that
101%, you can't improve 101% on your time. No.
Yep. But something that is pretty vital is protein. And we hear a lot about protein at the moment.
Yes.
I wondered if, Chrissy, if you could talk to us a little bit about protein.
This is a topic is very close to me. It was a big part of my PhD, actually, is protein intakes in adults. And it's a topic that even researchers can't agree on completely, I would say, especially at the moment. However, there is, so obviously, with runners, we focus a lot on carbohydrate intake, but protein is also really important, especially for recovery. So that muscle repair and recovery, also allowing muscle growth, also for our connective tissues and ligaments and joints. So, reducing risk of injury, for immunity, for a whole bunch of things. Also for satiety. So we know that runners can get really hungry. Running, can really increase your appetite. So adequate protein also can just help with that appetite regulation as well. We know that there's recommendations that are in the dietary guidelines, and then there's recommendations that is for muscle health and healthy aging, and they are different. So there's a general consensus, even though there is some debate around protein intakes, that around that 1.2 to 1.6 grams per kilo of body weight is sort of the sweet spot for the vast majority of the population. There is some evidence that going a little higher than that for some people may have some added benefit, but it's a bit like the 1%. It's diminishing returns. Does that make sense? Mm-hmm. When you're a runner, you've also balancing, you also do need to have that high carbohydrate intake. So if your protein intake goes too high, you're going to be displacing something, and that's probably going to be carbohydrate. So it's kind of a balancing act as well. But yeah, generally speaking, that 1.2 to 1.6 grams per kilo of body weight is going to really support the vast majority of runners. As I said, for some people in sort of that are really lean or in a big calorie deficit, going a little bit higher could have some benefit.
Does the source of protein matter?
Yeah, so look, obviously protein sources, some are more readily bioavailable, so things like whey protein, etc. Some of your plant proteins also contain dietary fibre, so they're not as bioavailable due to their amino acid content. However, as long as you're getting a variety throughout the day, there is now a lot of evidence that's saying that, you know, variety throughout the day, you're going to be okay. And once you get up to that higher intake, it's not as important where it's coming from. Yeah, but the important thing about protein too is I always think about protein as being a package. It's not just a single nutrient. So even though we have protein, so if you're having red meat, you're also getting iron. Yep. If you're having seafood, you're also getting omega-3 fatty acids. If you're having legumes, you're getting antioxidants and phytonutrients and fibre. So we want to have a variety of different protein sources because that's going to give us those other nutrients that proteins contain, and that's going to improve our overall health and diet diversity.
If you were, I'm just thinking of someone listening running, because if you went down the Coles supermarket aisle at the moment and you go to the protein aisle, you've obviously got whey, you've got pea protein, I think plant protein.
Yep.
That's probably where I was leading around. If you are supplementing because the training structure is really high.
Yeah, so an isolated whey is going to give you the biggest bioavailability.
All right, that's what I'm buying.
Yeah.
Timing, if that matters. I mean, generally we would advise that it's, you know, straight after training is that ideal window.
Yeah, so obviously your protein intake is going to vary depending upon whether you're, you know, it's the couple of days before you're racing. Obviously, you know, that's when your protein intake is going to be lower because you're increasing your carbohydrate intake. Immediately after a training session, you're ideally wanting to get some carbohydrate and protein in as quickly as you can. That's going to help with that glycogen replenishment, but also that muscle repair and recovery that we were talking about. Yeah, but the protein will be at a lower rate of carbohydrate. So with your carbohydrate, you'll be looking at about 1 gram per kilo of body weight. So if you're 70 kilos, you'll be looking at about at least 70 grams of carbs, whereas the protein is about 0.3 per gram. So, you know, you might be needing 25 grams of protein to about 75 grams of carbohydrate.
Another, just going back to, you know, presenting, if I'm a runner walking into a supermarket and looking at all the different things, I know collagen is getting like a pretty big...
Yeah, so collagen shouldn't be replaced as a protein source. So even though it technically is a protein, it doesn't, so using a collagen powder isn't going to have the same effect as using like a whey protein powder.
Oh, this is great. I think there's like, because I think clarity, because if you don't know, you don't know, right? And then you're getting marketed to so many different ways, you know, and these are some of the trend words that are coming out. Oh, do I need collagen? Do I need protein? Which one it is?
And I think one of the important things to remember with protein too is, look, it's definitely just a hype at the moment. I feel like protein's got like such a great marketing manager, whereas I feel like poor dietary fibre just needs a new marketing manager to make it sexy. Protein's like killing it. But when we look at so many of the protein foods that are in the supermarket, they're highly processed. If you look at the ingredients list, you know, we're getting into a highly processed food. So, we're still looking for, we ideally should be looking mainly for those whole food sources as much as we can.
Makes sense.
And we are going to take some questions from the audience a little bit later as well. So if anyone listening along does have any questions, feel free to pop them in the chat of the webinar. But I'm going to get on the front foot and ask a question that I know is going to get asked today, which is fueling for the race. And it's quite common, especially in the longer races, for people to have gut issues. And so I'm wondering if you've got any tips for fueling.
So I was actually having flashbacks driving here today of a few incidents I experienced myself. As someone with irritable bowel syndrome and long distance running, it was definitely challenging at times, but you don't have to be someone with a sensitive gut to still experience GI distress during a run. So I guess physiologically, there's a few things that are contributing to this. So when you're running, a lot of your blood flow is getting diverted to your lungs and your heart because they're having to work really, really hard. And it's being cut off from your gut. So your gut is actually getting less blood flow than it would normally do. So that it's slowing down and it's not functioning optimally to start with. Then throw in the fact that you might be consuming high amounts of, typically consuming high amounts of carbohydrate, and especially depending what type of carbohydrate. When we have big amounts of carbohydrate, that can draw water into our bowel, which causes by a process called osmosis. So that can cause diarrhea. We then have stress and nerves, which, anyone who has, had nerves before a race or nerves before anything knows how that can play havoc on your gut. Then throw in heat, potentially some dehydration, and you've got this mixing pot of things that can increase your motility, slow down your motility, draw water into your bowel, and all of that together can cause GI distress. So I guess a few things to try and prevent or reduce. One, do not do anything on race day that you have not practiced in your training runs. Your long runs leading up to the race is the time to train, to practice your fueling. You don't want to be doing anything new or trying a new brand of gel that you've never tried before. If you know that you have gut sensitivity, following a low FODMAP diet for the 2 to 3 days leading up to the race, so that's low in those fermentable carbohydrates that can cause bloating, can add to diarrhea or constipation, can be beneficial as well. Again, if you know that you have that sort of sensitivity to fermentable carbohydrates, being careful with the gels you choose with ingredients. So making sure that they don't contain those classic gut irritants, like things like inulin or sorbitol, sugar alcohols, because they're known culprits. So that's a few tips. And worst case scenario, always carry a wet wipe.
And what about the athlete's perspective, Courtney, on fueling? What have you found has worked for you in your long distance event?
Oh, wow. It changes, and even right now, it's a great time in endurance sport because a lot of the status quo is getting challenged on just how much carbohydrate you can take on. And there's obviously a trainability to that. So I think the mistake, if you're listening along, the mistake is, again, hearing, well, even just from the last world record, with the 2-hour world record that's been broken, we don't know exactly what's happening, but we're talking up to 120 grams.
Yeah, whereas rather than the 30 to 60, which was kind of like more the traditional, and I think training your gut.
Train your gut.
You do, and some people cannot tolerate any food before running, and then they have to build up to being able to have a rice cake with some honey on it or something, and then they gradually build up to having a little bit more, and then likewise training your gut during the actual race as well to be able to tolerate more carbohydrate intake during the run as well.
Yeah, for sure, and that's if you're not training that, it takes time to get there.
100%.
So it's like any other training you're doing. You want to be able to test what you're doing. Don't go out in the race and then suddenly go, hey, this is the strategy I heard, and then I'm going to go in and put that. Really interestingly, I was speaking to Andy Buchanan, who broke the Australian all-comers record and won the Gold Coast Half Marathon last year, and he's still said, well, I actually don't even know what I take in every hour. He used a liquid formula that's quite high, it was a Morton formula, but effectively there's other brands out there that do a similar thing. It's a mix of, it's kind of more like a trail mix, so you'd be 90 grams into a 500 ml flask. So that's quite a high ratio. However, he was saying he just takes on as much as he thinks he needs at a time. Then you'd go to another athlete who knows exactly, I'm going to take a gel.
This many grams.
I know I'm going to consume this gel in full every 20 minutes, and this is the end output. So you've just got to work it out, and training's the best time to do that.
Yeah. And I think also making sure that with your gels that you're also consuming water. So you're not just taking a gel straight without any water. Something that I personally used to do as a IBS sufferer, I used to actually mix my gels with water in a couple of my water bottles. And that way I could just take little small sips rather than downing like 30 grams in one hit. For me personally, that worked really well. So again, it's just coming up with those individualized, personalized strategies that work for you, and working out what your body can tolerate and what it can't tolerate.
And then what do you think? I mean, it's no secret in marathons all around the globe, they'll have flat Coke at the end of the race, like going to the most simple, like if it all, hits the fan and you're in trouble, what do you go to then? So I'm on the gel train and I'm taking in what my nutrition strategy is, but it's just not working for me. Is there any strategies then, what you can implement?
As in what you've trained for isn't working and then you...
Yeah, for example, I had that strategy of I'm going to have a gel every half an hour, for example, but I'm just not stomaching it. It's not working. I'm not taking on the energy I need. Is there anything you can do within the race to pivot?
Yeah, obviously you're going to be limited by what's available. Yeah, so what you've got available. So depending on what you've packed on yourself and then what's available at the aid stations. But if you're not tolerating gels, and then going to something that's in a liquid format you may tolerate better. And it's also going to depend on the sugar, how much glucose to fructose as well is in the carbohydrate. So sometimes just switching to another source may be more tolerable as well.
At some of the aid stations, there's a little bit of anything and everything available now, like you said, with the Coke, and some of them giving out lollies, Red Bull.
Yep.
So it must be tempting to grab something that you haven't been training with. Like you said, it's so important to train with your strategy that you're going to use on race day.
Well, I think like part of it is what you said, just changing up the taste, because especially if you're
you can feel sick.
Yeah. And it's a different proposition if the race winners are running nearly down towards 2 hours, but if you're out there running a marathon for 4 to 5 hours, there's not telling anyone what to do, but there's no real reason why you couldn't take on some solid food when you're going for that long, if that's what you were inclined. It's really person to person as to how you go about it. But I think you're right. Like at the back end of the course, one of the things I know, like I've always implemented, and I know a lot of the endurance athletes that I've been around at a really high level, is we'll have a nutrition strategy generally around some type of sports drink or gels that you run with, but we just get to a certain point where we're like, okay, now it's time we just get on the simple sugars and caffeine as much as possible. Yeah. So like a lot of marathon courses will have flat Coke. In my case, I'd often grab a Red Bull, which has got a little bit more caffeine, but a very similar sugar content. But at that stage, it's about just mixing it up. Yeah. And it's nearly as much for your mind of just going like, remember when you were a kid and you grab a bag of lollies and like snakes, and then suddenly you're going, it's the same thing. Like at the back end of a run, you do what you can do and what suits you to be able to get to the finish line as best as possible.
Absolutely. Yeah. I think mixing it up at that point in time can make sense.
And in your training now, have a bit of a picnic, take lots of different options out and give it a try.
Great excuse to have some lollies.
Yeah, if there were snakes there, killer pythons specifically, I wouldn't be able to go past that.
They might be a bit sticky by the time you get having them in your belt.
And another nutrition question I know is going to be so important. Is there any other nutrition mistakes that people can make that they should be aware of?
Yeah, I guess this is one not related so much to the race itself, but I think something that I do see quite a bit with runners is they can view running as a kind of golden ticket to eating whatever they want, whenever they want. And this is more of a long-term health diet perspective. And, relying a lot on those processed carbohydrates or those simple carbohydrates, which obviously have a really important place, without a doubt, they have a place. But in your overall diet, you're also wanting to make sure that there's also, whole grains with dietary fibre, et cetera, because we know that otherwise, you're going to be placing yourself at risk of not meeting your micronutrient intakes, not meeting your dietary fibre intake, and that's really important for your long-term health. I think another one is underfueling, both before racing but also immediately after, for that recovery process that we talked about earlier. I think too, a lot of recreational runners sometimes might fall into the trap that thinking that, getting their carbohydrate intake, having a big bowl of pasta the night before is going to be enough. Whereas if you're running those longer distances, we know that higher carbohydrate intake needs to be for a little longer, needs to be for longer than that. And, one bowl of pasta isn't quite going to cut it. So that would be, another one. And just making sure that overall diet quality between your training and your recovery, that you're also making sure that your overall diet is still,
Yeah. Speaking of big bowls of pasta, what about carb loading? That's another common thing that runners talk about. How important is carb loading before a big race?
So if we think about a car and it's got, we put fuel in the car and we fill the tank with fuel before we go on a long trip. Our body's just the same, except our fuel is glycogen. We've got glycogen, which is our storage form of glucose, and we store most of it in our muscles. We store a little bit in our liver, but most of it is in our muscles. So before we have a big or a long race, we want to make sure that glycogen tank is filled up to the top, because that's going to give us the biggest reserve of energy to draw on during the race. We also know that glycogen reserve is only going to get us through for about the first 90 minutes. And so that's why fueling during the race becomes so important as well. So whether we need to carb load or not really depends on the length of the race. So if you're just doing the 10K, having that bowl of pasta the night before and having, a carbohydrate-rich snack before you race that morning is probably going to be enough. If you're doing the half marathon, that's where sort of the 24 hours before, we're going to want to have some intentional higher carbohydrate intake. And if you're doing the full marathon, it's a non-negotiable. You're wanting to fill that tank to the absolute top. So that's where we're looking at, 2 to 3 days. For really highly trained athletes, such as Courtney, probably 1 to 2. Would you be 1 to 2 days? Or...
Yeah, well, it's something I'm considering at the moment, like what carb
so
would be.
for
those 2 hours in multi-sport like triathlon, it's probably not, because you're using different muscle groups.
Yep.
It's probably not as important, but for the specific marathon running, it becomes very important.
Yeah, so that so in that 2 to 3 days whilst you're tapering, and this helps also with that glycogen replenishment because you're able to take on more of the carbohydrate, you're wanting to increase your intake quite significantly for those couple of days leading up to the race. So we're looking at 7 to 10 grams per kilo of body weight. So if you weigh 70 kilos, that's like 490 to 700 grams of carbohydrate per day, which is a lot. I think the important thing to know is it's not that you're suddenly increasing your overall energy intake, you're changing the proportion of your energy intake to be predominantly from carbohydrate. Does that make, so you're just kind of changing the ratio. And you're wanting to split it evenly over the day. So really, snacks are going to be your friend, making sure that you're having lots of carbohydrate-rich snacks. And making sure too that sort of the night before, you're not wanting to have like a huge meal the night before for that GI distress the next day. So making sure, possibly even having a bigger lunch, but, supporting it with snacks as well to reach that carbohydrate.
What's your pre-race meal? Courtney, do you have a go-to meal?
Well, over the years, no. I never tried to get stuck in one. The reality was we were racing in different places, different continents, different countries all the time. So we got very used to just being able to run with it. However, for the morning, I'd always have, and especially more later on with trail running and running itself, is it's very easy just to go and get some porridge or a banana. You know, they're available at every supermarket, so I get my stomach very used to having that as a carbohydrate source, and then obviously some type of topping it up with some type of sports drink or whatever it is. I mean, caffeine's a big part of, it has been always a big part of my racing strategy. Over 2 hours, making sure like I'm begin with caffeine, but then also at some stages within a longer race, topping up with caffeine.
And how much caffeine were you generally topping up with out of?
So in the early days, we would there wasn't a lot of data to go with it. 3 to 6 milligrams. Per
Yeah, I was going to say
kilo
3 to 6
weight. And
per hour.
Per kilo of body weight,
yeah.
and then topping up. So for me, we did some testing prior to, I believe it was Beijing Olympics, and my peak caffeine was around 45 minutes. So we'd have an idea of when to
When you
intake.
could, yeah.
Knowing half-lives, then being able to top up. So like I'd have a strategy in a 2-hour triathlon, just because that's the one I know best, is where prior to the race, about 210 milligrams, give or take, and from some different sources. And then within the race, either taking on additional caffeine on the bike before I went out to run, so about half an hour before the bike ended, to make sure I was topped up. And then again, just through different sources. It's like, just like food, you know, the caffeine availability can be through no-dose, it could be through Red Bull, it could be, you know, there's a number of different ways. Gels now obviously contain caffeine as well. So it's just working out which source you take in. But again, it's something you need to train because...
Yeah, because caffeine can also impact your gut.
I was going to say, if you've got problems...
That one I forgot to mention before. So yeah, caffeine is, you're definitely also wanting to trial it and train it because that can be a gut irritant as well.
Yeah, but nutrition's definitely changed over the years for me. I know when, and this is what I'm like talking right now, and we're talking about Gold Coast Marathon coming up, I'm actually throwing up, and I'm going to do some trialing in some of the training I'm doing at the moment, whether I go with what I'm used to at the moment, which is probably more a longer distance strategy around trails, where I'm taking on those high carb sports drinks at quite a high carb ratio, or whether I do just go on a gel strategy. So that's like everyone out there, I'm in the same process of working out for a 2-hour run at that intensity, what one's going to work for me. And that's the other thing, is we mentioned it earlier, depending on how long you're going to be out there running, I think that strategy probably changes. Like if you've ever tried running, you know, at a quicker pace and maybe sprinting along and then trying to consume fluid, it's quite difficult. I think a few of our marathoners who are running, you know, the best in Australia or the best around the globe at the moment, we're talking about just how hard it is to be running that pace and then trying to breathe and then be taking on fluids. So sometimes that's where gels just make it that much easier. However, from gels, you're not going to get the amount of that out of that one gel of carbohydrate that some of the new sports drink tools are offering.
Yep.
So yeah, you got to find that balance.
Yep.
I'll let you know what I figure out.
And just before we take some questions from the audience, I just want to come to pacing, which is a crucial factor, I think, to run a good marathon. I was wondering if you could tell us a little bit about your experience with effort control and pacing the run and how important that's been for you.
Yeah, I mean, from when I was a young kid to now, when it comes to running, nothing's changed. I always have a saying that if you run off the start line and you feel like you're going too fast, you're definitely going too fast. If you feel like you're running at the right pace, you're probably going too fast still. And if it feels conservative and easy, then you're in the right zone. I mean, that's like I tell my son that if he's going to run a track race at school or across country, and we will talk about to Olympian to do the same thing around. That's a starting strategy. When it comes to pacing in the marathon, I can only take the experts and the best that I've spoken to, and nearly without, except for one I've spoken to lately, nearly without a doubt, even split or negative splitting a marathon, everyone has their best race. So that means being able to go, like if you'll take the halfway mark as an example, you want to reach halfway at the same time, then you'll run the second half of the race, or ideally even be able to get to halfway or even 30 kilometres at a place where then you can actually speed up from that point on. And that's tricky, right? Because you've really got to know your limits, and you can work that out in training. And
It's something that you can do, because one strategy that I did was fast finishes in my long runs, and I found that really helped me achieve that negative split in the second half. So when I did my long runs for the last, and I would increase the length, I would actually increase my pace for the last 2 kilometres and 3 kilometres and 4 kilometres, and and then when I got to race day, I could actually get to that last 8K and be running significantly faster than what the pace I'd been running the rest of the race.
100%. Yep. Well, Andy,
Yes.
I was given a session last week because I haven't been, like I said, I haven't been probably doing the training that I wanted to be. And then we worked out, I was like, everyone kept saying, well, it's only 6 weeks to go now. It's only 5 weeks to go now. And then I'm like, oh, geez, I better start to really, we better lock in here on some marathons. So one of the sessions I was suggested to do was a 2-hour run. And this is anyway, just at your own pace. And then to do a 20-minute marathon effort after that stage. So that's, if you've got to train up to that, obviously, to get to that, to be able to handle that. And look, I talk about muscles. I've been training quite consistently for a long time, but even doing that effort in training, I pulled up sore for 2 to 3 days of that. So I know now that I'm not, right at the moment, I'm not conditioned to do that.
You met your capacity.
100%. So I need more conditioning around that before I go to the marathon, or I'm going to be hobbling around looking like a marathon runner downstairs for sure.
You might have to come and visit the osteos at the end.
Yeah, for sure.
We've got a couple of questions from the audience, so I'll put it to the panel. We've got a question about getting a stitch. Any tips for working through a stitch during a race?
So there's a few different approaches. Sometimes it can be the way and the rhythm of breathing. So it depends where, So I think trying to slow down the breathing a little bit and get your running stride in rhythm with your breath can help. But if it's persistent, like lots of people are trying the pickle juice and things like that, the theory behind that is that it works with the vagus nerve and the nervous system to sort of break that neurological cycle and put a sort of a little bit of a shock to the system. But I think sometimes just slowing down the pace a little bit, trying to regulate your breathing and then start off slow and smooth again, that can help.
Yeah, I've always found some deep breaths, box breathing type of technique, belly breathing, to have helped a little bit.
But that would help the nervous system too, right? So
and the diaphragm muscle is connected to the deep hip flexors, the psoas as well. So if you're firing up your psoas, you're working really, really hard and then trying to breathe relaxed and slow at the same time. They sort of work in opposition. So you do need to slow your pace down a little bit and try and slow your breathing down at the same time to get back into more of a rhythm and settle the nervous system. The thing that can spike it is when we start going into a fear around the stitch as well. Like if you start panicking or getting a bit of anxiety around that. So just try and reassure yourself out there as well, I think is really important.
Fingers crossed. Fingers crossed there's not too many stitches out there. Courtney, this one's for you. How do you get through the moments in a race when you hit the wall?
All right, I've got an easy strategy around that. It's probably not as easy in practice as the theory, but I've always found hitting the wall, actually, I'll take one step back before I answer it. Hitting the wall is generally going to be to do with nutrition. It's blockage. And there's no
tank is emptied.
Yeah, there's no real quick fix around that. You've gone too far. And look, in longer distance events, sometimes you can get your fuel up and get back on track, but it's not a quick fix. I think probably what I can answer with a better strategy though is you're going to go through up and downs in marathons or any long distance events. And what I've always found is when you get to those really tough times is, and it's no secret to break things down into smaller chunks, but the best technique I was given years ago, and it works for me, is I then start concentrating on doing 10 of my best steps on one leg and then counting 10 of my best steps on the other leg. And so what it does is it actually starts to make you think about the form and the way you're running. So like actually concentrating on landing on that leg well. And effectively all you're doing is taking your brain and getting yourself away from thinking about how far have I got to go, how much am I hurting, and you're just putting your mind into a different space. And those 10 steps on one leg and 10 steps on another leg suddenly become a kilometre, then another kilometre, and I generally find I come back pretty good.
Yep.
It almost puts you into a meditative headspace too, right? When you're focusing so specifically on something else.
And I'm sure there's many ways to many strategies around the same type of thing. But for me, that's just one that's always worked. Another one I've heard is, especially out on somewhere like the Gold Coast, is, okay, we'll just concentrate on running to the next light pole, pick another landmark and run to that. But I still think you've got an end point with those ones. I like where it's, I think it's probably similar strategies to, could be box breathing, or it could be, counting, going to sleep. It's all those things just to take your mind off.
And it's taking it away from distance as well.
Yep.
Do you use music for races and long runs?
I don't, but that's another thing right now, going in a very different situation, running a marathon, where, Gold Coast Marathon, where I'm at my age and where I'm at the moment, like I'm not going to be fighting to win the race, which I definitely wouldn't be wearing headphones. But it's a situation now where I go like, yeah, I'm leaning towards maybe, and I'd only ever wear one. I think regardless of running, when you're in big events or big environments like that, and there's going to be a lot of people wearing headphones.
To be aware of your...
You want to be aware of your environment. And there's a certain element of, if you're participating in the marathon here at the Gold Coast, there's such good crowds. If someone's yelling out to you, you want to be able to hear them too, because that builds up the adrenaline and gets you running.
Connection as well, isn't it?
You don't want to not be able to hear the guy talking next to you. Yeah. But I do think there's a rhythm, that music can definitely help if you've got...
That could be a strategy towards the end of the race if you're starting to...
Yeah, there's no secret that both in training and racing, if you get the right beat in the music and you've got a strategy around... I know for me, I am very close to that. Some people don't like saying it anymore, but like a rule of thumb around 180 steps per minute, just to make sure your cadence keeps up. If you can pick songs that have a beat around that, it definitely subconsciously helps you to land on the beat. Like I know in training, I have some very, very specific songs that if I'm getting back from running and the rhythm's just not quite right, I like have there's a particular Dallas Woods song that I have, Get By, and I know that beat for me actually puts me into a rhythm, and I normally get back running pretty good off that. So a few different things you can look at.
There's also apps out there that will take your playlist and try and mix it into a certain beats per minute if you want that.
Yep. But then you don't have control over the songs.
And I love the fact that as a Gold Coast local, you've got to be looking out for the fans out there. You've got to...
Yeah, it's a great... I think as running has evolved at the moment and is really in trend, the thing I've noticed coming down to the Gold Coast Marathon and watching from afar from the last few years is because there's so many new runners coming into the marathons, that brings with them so many more family and friends and everything else. So the crowds actually on the course are getting larger and larger, and they're not just down there, taking a look. They generally have a proper interest in someone within the race. But that works for everyone, right? Because the more people are lining the course, the more it feels like a great event, and it's going to continue to grow.
Gives it that atmosphere. Yeah,
for sure.
This question could be a tricky one, Bimbi. It's for you. It's about IT band pain, and they've asked, does IT band pain go away in 4 weeks with stretching and strengthening? They can still run 10 to 15 kilometres with slight pain on the outer knee, but they're worried for the marathon. If they can still manage that in 4 weeks.
Oh, that's a tricky question. Like, I agree, because they're sort of not going to like the response. It sort of depends. It really depends on training load and what you're doing. So if you're unsure and you've tried adjusting training load, maybe it's a good time to check in with a coach or an exercise physiologist, osteopath, physiotherapist, somebody to give you some more specific advice around training load, and if there are any sort of biomechanical restrictions or areas that you could focus in on around the functional mobility aspects of what's going on as well. Because if it's persistent, I just think it's good to get that checked. But absolutely, it's resolvable within that time frame, but probably not if you just keep doing exactly the same thing that you're doing now. That makes sense.
Is there a specific exercise? I mean, obviously treatment's going to be best, but is there a specific exercise you can do before you run that has an effect to help with the ITB?
I think that functional warm-up, so we think about the ITB band being between two major joints, you know, the knee and the hip. So warming up the muscles around your hips and your pelvis and your lower back. So sort of functional hamstring warm-ups are really good as well, leg swings, squats, but even just something as simple as walking as a warm-up, because that's the biomechanical pattern of running, obviously. So I think it really just depends on what's going on for the individual. I wouldn't say that there's one particular, but perhaps that's an osteopath response. I wish I could give a silver bullet answer, but unfortunately it's,
Go and see an osteopath. That's a good way to wrap things up, actually, because unfortunately that's all we've got time for. Thank you, Courtney, Bimbi and Chrissy. It's been great to hear from you and give us some great tips on training and injury prevention and nutrition. And also thank you to our audience for coming along and listening, and also giving us some interesting questions at the end there. We look forward to seeing you at the Gold Coast Marathon. Look out for the SCU Recovery Hub. We'll have our osteopathy students there providing some individualised treatments, and we'll also have our naturopathy students there providing a range of recovery teas. We'll also have our exercise science students and osteopathy students in the ASICS recovery zone, where they'll be providing treatments and also helping you with stretching, foam rolling, and also some sessions on the recovery boots. And if you'd like to do some training with us, we have a run club. There's details on the SCU UniLife website. You can go on there and add yourself to one of the WhatsApp groups. But good luck everyone for the race, and we'll see you at the recovery zone.